I work for a nonprofit and a rural health clinic because I love the mix. I love the mix of patients, and I don't want to say you know, no, we won't take this insurance, or yes, I leave that up to the administration. I see patients. I'm in an area where it's still physician friendly, but we still have to go through these things about prior authorizations or what the insurance company will or won't do. The medication prices are astronomical.
Right. Yeah, I think there's people like, I think finally, unfortunately, in the States, it seems that the only solution to capitalism is capitalism, which is honestly, it's a bit of a joke to begin with. But it seems at least there are people like Mark Cuban that started like that cost plus drugs to start selling generics a lot cheaper, and hopefully there'll be some sort of legislation soon. But are you seeing any prices coming down anywhere else in the system, or is it just something that you have to deal with to try to find a way to get the best care that is possible?
A lot of times we don't know what the cost is going to be to the patient until we send the script,
Wow.
and that's unfortunate.
Hmm.
Um, it really depends on the type of insurance that they have. Don't even get me
Right.
started on that. It's it's not ethical. It's not ethical because again, this is a decision that the physician and the patient are making together, right? This is something that um, I like to try to approach it as they're the experts in their body. I'm the expert in medicine. We try to have this be a team approach. So it's a shared decision making as to what the next best step would be.
Hmm.
Instead of me saying you're going to go do this, oh, that's paternalistic. That's not really the way I think medicine is nowadays. Maybe 40, 50 years ago, but now it's just shared decision making. And we've made this decision. We've come up with this plan in the office, and now it's cost prohibitive. And it's first line or it's second line medication, but it's cost prohibitive. That makes no sense. Especially when a lot of the newer medications that are coming out for, like example, high blood pressure and diabetes, it decreases the risk of heart attack. It increases longevity, and it's having a lot of good positive effects. But it's cost prohibitive, and this patient needs it. That pisses me off every time. I mean, I get mad. I get mad in the office,
Right.
in my office.
Like that
But
seems just like a normal human response to be angry to these such basic things. And not to belabor this point too much, but even in Canada, I'm experiencing it a little bit where a relative is on a certain kind of expensive medication for the ailment that they have that's quite serious, and they've had great results with it for the past 5 or 6 years now. And now I've heard that now they need to go on the generic, and the Canadian government will not even allow, like there's no option to even appeal to get the brand name, even if someone wants to pay for it. They've just decided it's going to be cheaper for them to get the generic, and the studies are showing, like at least it's evidence-based to a certain degree, that the generic is showing similar to exact results from the brand name. But we all know that it's to switch to a generic, sometimes the brand name just has something that has better results. And so it's frustrating even to see, a relative that is getting good results for a serious ailment on a brand name medication having to be forced to go on to the generic. And everything is about cost savings these days, and none of it is for the benefit of the patient. And so I understand how people can be so angry over pharma companies and hate pharma companies so much. But part of it is also the government, the society that we've built. Like, listen, I'm happy to hate on a pharma company as much as the next guy, but like there is needs for research and for new medications to come to market. Like there is a need in that, but we've just set up the incentive system so screwy that we've put like shareholders beyond patients. And it's like that's why when you say you get angry in your office, like that seems like the reaction everybody should have.